Thank you, Mr. President. Mr. President, I rise this afternoon to talk for just a few moments about a special hospital in Pennsylvania, Wills Eye Hospital. This is a hospital that is not only critically important to our state, but to the nation as well. It serves people from across our state and across the country. Wills Eye Hospital is a public trust that was gifted to the city of Philadelphia, and it was founded in 1832. It's the first dedicated eye hospital in the country providing care to the blind and the indigent, something that they still do today. They still have that same mission. Unfortunately, if the Center for Medicare and Medicaid Services, what we know as CMS, if that agency has its way, Wills Eye Hospital will no longer be able to provide this kind of care. This is world-class care that so many Pennsylvanians and so many Americans can speak to personally. I had a personal experience when my daughter Julia had an eye problem years ago, and Wills Eye did great work for her. In this case, CMS is using an arbitrary ratio of the number of inpatients and outpatients to say that the hospital, Wills Eye Hospital, is not a hospital and should be what's known as an ambulatory surgery center, which could have drastic implications and ultimately force Wills Eye to close. And again, this was an institution founded almost 200 years ago. Last week I went up to Wills Eye in Philadelphia to talk about this problem and had the opportunity as well to meet Joey Povio, who's pictured here in this enlarged photograph. Joey is 6 years old, and he has retinoblastoma, which is a type of ocular cancer that, if left untreated, will lead to his death. According to the American Cancer Society, there are 200 to 300 cases of retinoblastoma diagnosed each year. In the last fiscal year, Wills Eye Hospital treated 110 unique individuals with a diagnosis of retinoblastoma, or almost 37% to 55% of the diagnosed cases in the country. So you can see the impact of just one hospital on a substantial problem that Joey has and that children across the country have. Fortunately for Joey, he's getting first-rate treatment. But we have to ask ourselves, what about the others who have retinoblastoma? What about the children who have retinoblastoma in the future? What will happen to them without Wills Eye Hospital? And you can tell from this picture not just how dynamic Joey is, and I can attest to that personally after having met him, but how focused he is on getting better and how confident he and his families are that he can in fact get better because of the great work done at Wills Eye Hospital. Now, there are many that might think that this is just a unique situation or simply an unfortunate situation. And certainly it is for Joey and his family and for others who have retinoblastoma or a number of other ailments or problems that center on their eyes. And thank God we have Wills Eye to treat those problems. But there are other hospitals in the nation that are dealing with some of these same issues, and especially dealing with issues that relate to their interaction with CMS. And these are obviously some great hospitals that I'll mention in a moment. But in this case, for whatever reason, I think CMS is treating Wills Eye Hospital unfairly. I think that's an understatement. In this case, we have a number of institutions that have a bed ratio. That's the interplay between inpatient and outpatient that CMS is focused on in this circumstance. There are some hospitals that have a bed ratio that's lower than the one at Wills Eye. And because those numbers are lower, that would mean that those hospitals should be the subject of the same kind of action that CMS is taking when it comes to Wills Eye. When Wills Eye was first denied hospital status, their bed ratio was 17%, but according to data provided by the American Hospital Association, the Cleveland Clinic, one of our great institutions, has a ratio of 6.14%, obviously lower than 17%. Stanford Healthcare, another great institution, has a ratio of 10.5%, again, lower than the 17% at Wills Eye Hospital. These are the bed ratios, as I mentioned. So it doesn't make much sense that CMS is focused on Wills Eye and is not taking the same action or similar action as it relates to those two other institutions. Now, no one would doubt that these two premier institutions, Cleveland Clinic and Stanford, are hospitals. There's no question that they're hospitals. Yet, CMS is focused on Wills Eye in a determination that they've made that it is not a hospital. It doesn't make any sense. CMS does not even have a definite ratio a facility needs to meet in order to have inpatient beds. They simply need to be, quote, primarily engaged, unquote, in providing inpatient services. So there's no definite ratio, and yet they're taking action that is to the detriment of Wills Eye Hospital, and I believe, and I think the evidence and the record is clear, the actions to the detriment of a lot of people in southeastern Pennsylvania, a lot of people throughout our Commonwealth, and indeed throughout our nation. So in this case, I believe, obviously, that CMS has made the wrong decision. Now, you would think that in order to help determine what a hospital is doing, that a representative from CMS would visit and would do a thorough review of the hospital that you can only do in person. You can't do that just based upon charts or phone calls. That you would think that someone from CMS would come and see Wills Eye Hospital firsthand. They really haven't done that yet in a manner that's connected to the actions that they've been taking. So I've encouraged them to do that. It's not a very burdensome task to get in the train, go to Philadelphia, spend some time at Wills Eye Hospital, and use that as part of the basis upon which you make a determination as an agency of government. In this case, unfortunately, CMS has made an arbitrary decision, which is wrong. This decision threatens this world-class hospital, and that's an understatement. In essence, this decision makes no sense. Wills Eye is a hospital. It provides great care for people that can't get this care almost anywhere else in the country, especially when it comes to children, and especially when it comes to that diagnosis that families get of retinoblastoma. Without the intervention of the great work at Wills Eye, those children will die. So I'll continue to urge CMS to work with me and to work with Wills Eye on a solution that resolves this bureaucratic problem. This is basically what it is. A bureaucratic approach that doesn't make sense in the real world of quality medical care, the real world of the services that Wills Eye provides, in the real world of Joey's circumstance and children like him across our region in Pennsylvania, but also across the country. Mr. President, I would yield the floor.